Hello, I want to talk about the three best and most effective stretches and exercises for the shoulder.
We are Witty, Pask and Buckingham, chartered physiotherapists in Northampton. We have been the leading physiotherapy clinic in the region for 40 years. We treat bone, joint, muscle, tendon, ligament and nerve issues all over the body. Using manual and manipulative treatment techniques, shockwave and exercise regimes, we work to get you back to full health as quickly as possible.
The shoulder has the rotator cuff, which has got four tendons, four muscles that sit within the joint, and they're responsible for most of the problems that we have around the shoulder. They give you pain in and around the top of the shoulder, but also commonly refer down to the side of the arm. If you have sharp pain, if you just reach up into there, when you're reaching up to the top, you're getting sharp pain, or the problem came on suddenly when you were lifting, that's really a time to go and get it checked out properly, and the video isn't appropriate for you. If, however, you're getting pain at night and when you're laying on it, again, that's the time to get it checked out. If it's intermittently sore, it just kind of comes and goes, you're lifting or pulling, you get a bit of pain like that, it's achy, it's just niggly, then these exercises are the perfect ones for you. So tightness in the front of the shoulder and in the pec muscle particularly affects the way in which the shoulder joint moves and starts to create pinch of these rotator cuff muscles in the joint. So lengthening out across the front of the shoulder here is a really good place to start. So take the arm to be stretched, place the elbow on the wall or a door frame at about 90 degrees to start with, chest up and back, and then you rotate across there, and what you'll feel is the stretch across the front part of the shoulder into there. Don't force it, don't push into sharp pain, it's just into a gentle tension across there. Hold it for about 30 seconds at a time. And then relax off. You can also just alter the height slightly up to around ear height with the elbow and do the same thing, again just to get that stretch across the front of the chest. Tendon loading is known to help improve inflamed tendons. The way we do this very simply and safely in the shoulder is you take your hand, you place it against the wall here, set your shoulder down. What we don't want is a really hunched up shoulder, anything lifted up through here. We just need it drop down so you're working at the lower part of your shoulder blades. And then the movement is you're just pushing with the back of your hand into the wall. Just push, 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 push. Not into anything sharp, no sharp pain. We just want stress and a bit of tension through there. And you're holding for 3 lots of 45 seconds, just push, 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 push. Alternatives is you can also just use your hand and just push into it like that, just to resist, so you can almost do this anywhere. Set the shoulders down and just push. Much shoulder pain is caused by poor shoulder blade or scapular stability. Our sitting postures, computers, desks, etc. lead us to have shoulders that are very hunched, tight on the top, tight in the front, with the pec stretch we talked about earlier. Getting these muscles at the base part of the shoulder blade to activate and get them to work much better certainly helps to stabilise around the shoulder and takes away a lot of the pinch that you potentially get with these tendons in the arm itself. So the way to start this is about these muscles that come down off the base part of the shoulder blade here. Keeping these ones at the top here really relaxed. So just set and down and activate, pulling down through here and just holding 30, 40 seconds, just keeping that tension on through there. Then relax off and then set down again, just holding through there, again, keeping this relaxed on the top there.
If these simple techniques don't help the problem within a couple of weeks, then you need to get it further assessed. We need to work out if there's a bony issue, if there's actual torn tendons, if there's further damage to muscles. It needs to be properly assessed by a chartered physiotherapist. What a physio would do with this is take it through full range of movements, lots of very specific special tests to work out exactly what the problem is, decide if we need further information from, say, scans or x-rays, but particularly work on a treatment plan for you, send you away with the right work to do any manual therapy that we can do at the time, and any further investigations required on from there.